Yes. So, right. Now we see extract 1 has 12 questions. Extract 1 has 12 questions. So 12 questions, and here there are 30 seconds. Chandan Mandal. Type your name in the chat box. Chandan Mandal, first name and second name. 30 seconds. 30 seconds. So that means 2.5 seconds for each question. Remember that. 2.5 seconds. So 12 questions, 30 seconds. Now you should know one thing here. 12 questions. For 12 questions, you have 30 seconds. For 12 questions, you have 30 seconds. I'm talking about the probabilities. Then if 12 questions have 30 seconds, then one question will take how much time? How much time you can take for one question? You can take 2.5. 2.5, huh? So 30 seconds, oh yeah, 2.5 seconds. 2.5 seconds per question. So this is the most important point you have to notice. So for every Mona Abdul Fattah, very good. So Anushka, Maimuna, Sangeeta. Right. Sure. Yes. Let me take the attendance. So Sangeeta Patel is a regular student. And next one is Maimuna Saeed, Sangeeta Patel. Next one to come was Anushka Gupta. Anushka Gupta, 858. Next one is Puramzia, 9. Puramzia, 9. Judy Vijo. Judy Vijo at 9:10. Then Mona Abdul Fattah. At 9:12. Yeah. So who else? Chandan Mandal. Type your name in the chat box, please. Chandan Mandal. Type your name like others. 9:15. Yeah, good morning. Yes. Right, we are moving ahead. We got the attendance. Fine. So This is the most important aspect here. Yeah. So 12 questions, we have 30 seconds. So for every question, 2.5 seconds. Now let us see what is important one here. So there are three important things here. First one is an ophthalmologist. He is talking to a patient, and his name is Dominic De Souza. So who is speaking? To whom is he speaking, and what is his name? Ophthalmologist's name we don't know. We do not know the name of the ophthalmologist, but his professional name we know, and this is he's talking to a patient, and the name of the patient is Dominic. These are the three important things that we know here. The next one, there are 12 questions in this. There are 12 questions. And you have to complete the notes because it is incomplete. You have to understand that it is incomplete. Incomplete without, see, like this, incomplete. It's not complete. So you have to fill it with a word or a short phrase. And that only you hear. Hearing is important. If you don't hear, you imagine and write, that will not be benefit. So you have to hear and then write. That means it must be there in the audio. It must be there in the audio. For example, you hear a word listen and you write the word hear. That is wrong. You hear a word hear and you write the word listen. That is wrong. Both mean the same almost, but it is not right. So what it comes out from the audio, that only should be written. So this is the most important or the dangerous area. So what you hear, this hearing is more important than anything else. This hearing is more important than anything else. That is, hearing is more important. Remember that. So if you don't hear the word, you will lose it. If you don't hear the word, you will lose it. And you write some other word also, you lose it. So be very careful. All the answers, all the 12 answers must come from the audio. That's a must. Yes, Bipana Shah. Write your name in the chat box, please. What is your attendance? Bipana Shah. Yes. Fine. Bipana Shah at 9:19. Yes. Please try to come, all of you, early. We are starting at 8 o'clock every day. So, right. So, you can see it very clearly. Now you have 30 seconds to look at the notes. This is called pre-listening time. Pre-listening time. Pre-listening time. So if you have any friends, you can send this link to your friends. They can also join. Yeah. So this is called pre-listening time. This is called pre-listening time. Yeah. Pre-listening time. So pre-listening time, what you are supposed to do? So what are you supposed to do in this pre-listening time? In this pre-listening time, you have to do scanning, skimming, scanning, and solving by guess, or you can say guessing. Yeah. You have to, in this pre-listening time, you have to do these three things. So pre-listening time, you have to do these three things. Right. So 2.5 seconds. So this is it. So you can say skimming, scanning, and solving. These are the three steps you are going to do here. Three steps. So 1, 2, and 3. These are the three steps that you are going to do here. Yes. Who is the next one who joined? Muhammad Abdullah. Type your name in the chat box, Mr. Muhammad Abdullah. So these are the three steps that you must follow without fail. These are the three steps that you have to follow. Right. So that's it. First one is skimming. Second one is scanning. And third one is solving by guessing. So these are the three steps you have to notice without fail. Three steps. Right. Now, what is the skimming? Skimming means superficial things, like these bold ones. First one, skimming what? Skimming what? Now I'm targeting red color. Skimming this one, bold ones. Skimming this one. Skimming, yeah, these things. This is skimming. Skimming is this. Skimming is the bold letters. So you do skim the bold letters. History of the condition. That means it's talking about the big background. It talks about the background. That's it. Yes, Muhammad Abdullah, type your name in the chat box. So that shows what time you came and the timings. Yeah. So scanning. Next is the scanning. Scanning, I'm going to show you by say blue arrows. Scanning. Scanning will go to the blue arrows. Blue arrows. What is that? Scanning. Name of the profession. Name of the person. Name of this person. And then you can say some important words called, sorry, myopia, glasses, symptoms, like this one. Yeah. So Sujita Perimbadas. Sujita Perimbadas. Type your name in the chat box. Yeah. Type your name in the chat box. Maimuna Saeed. Show how the name should be typed in the chat box. Type your name Maimuna Saeed so that Muhammad Abdullah doesn't know, he got for the first time. And Sujita Perimbadas. So that is it. This is how Sujita Perimbadas. Yeah. Like this you have to type. Muhammad Abdullah, you also. Sujita Perimbadas, you have done one mistake. What is that mistake? S capital letter, P capital letter. It's not a S a small letter. Your name is special. Remember that. It's not an ordinary name. Ordinary names start with small letters. Special names start with capital letters. If you think your name is special, write S capital and P capital, please. Yeah, that is what it is. You are very obedient. I like this obedience. Yes. Muhammad Abdullah, I want your name also. Please type like that. So we have some standards. We are following some standard rules. So we have to oblige with those things. Yeah, right. So now we are going for scanning. Skimming means bold letters. Skimming means bold letters. Now what we are doing in the part of skimming. In skimming, what we'll do. In scanning, what we'll do. In solving, what we'll do. So I want you to, if you want to know what we are going to. So Muhammad Abdullah is Nasira Batul. B also capital letter, Nasira Batul. B also is a capital letter. I was expecting a man's name because of the name there. Okay. Nasira Batul. Yeah. So that's it. I changed your name to Nasira Batul. Thank you. Yeah. So thank you once again for obliging. Yeah. Type B capital letter because it's a special name. So first thing is skimming, scanning, and solving. Skimming, scanning, and solving. Okay. Right. So now let us see here very carefully what we are. Thank you, Nasira Batul. Sujita Perimbadas. From which place? Are you from Sri Lanka? Are you from Colombo? Nasira Batul. Are you from Egypt? Yeah, just let me know if it is confirmed. Type yes. Okay, and type your native place like Colombo, Sri Lanka, or Cairo, Egypt, or some other place, Egypt. Nasira Batul from Pakistan, very good. Sujita Parimbadas from Tamil Nadu, Pakistan. P should be capital letter. P should be capital letter, right? P, name of the country should be capital letter. Remember that one. It's special name. Right. So now there are 10 members on board. Now what my question is, Chandan Mandal from Bharat. Okay, right. Yeah. The next question for you is, do you want me to just run like a plane No, they just want me to rush past the answers. Number one, that is option number A. Option number A. So try to understand what I'm asking. This is option number A. Do you want me to rush past the answer? Option number B. Do you want me to explain the basics? Tell me, A or B, your choice. Only one letter you have to write. No need more. Just write one letter, A or B. Do you want me to rush past the answers or do you want me to explain the basics? Yeah, who came newly? R.N. Kumar. Can you write your, what do you mean by R.N. Kumar? Okay, write your full name, please. R.N. Kumar in the chat box. Yeah, come on, give your voting fast because your voting is very, very valuable. Based on that one, I will go you. If all the people will give A, then I'll just rush past. If all depends on that one, how many people give what? So 50%, 50%. If 50% say A, I'll rush 50% fast and 50. If all the people will give B, all basics, everything in detail, I'll explain so that you will not miss any answer. Your wish. If you don't give voting, that means you are not a participant. Okay, if you are not participant, there is no need for you to be here. Yeah, this is a military game, military. If you want to win a battle, you have to fight, take your soldier and hit your guns, that's all. Okay. So 1, 2, 3, 4, 5, 6, 7 people have given. What about the others? There are 4 more. Yeah, fast. 10 seconds more. That's all. Because I have to give a lot of things. I don't have time to waste. Yeah, and I'm going to give you a very special episode, so you can call the people who love. Invite. I'm giving you out of my love to you. Invite. Here. Okay. Freely you get. Freely you pass on the message. Invite. I want these lectures to become webinars shortly. Now we are only giving lectures. I want to make a webinars, big webinars. Yeah. So invite, please invite your friends and colleagues. Please invite your friends and colleagues. Yeah. Rajiv, write your full name, first name and second name. Rajiv, write your first name and second name. So Rajiv is renamed as Rajiv second because I don't know your second name. RN, Nooreen second name. I need your second name, Nooreen. Very good. Nooreen second name. Yeah. Right. Rajiv Nooran. Okay, fine. Nooreen second name. Yeah, Rajiv Nooran. N should be capital letter. Okay. N should be capital letter. Okay, I made it capital letter for you. Rajiv Nooran. Type your name in the chat box. So I will enter your name. Yeah. Right. Type your names in the chat box. Yes, your attendance is taken, so that if your attendance is taken, you will be invited for the next sessions whenever I'm giving you free sessions. Okay. Yes. So here it is. Attendance. Yeah. So I'm going to give you the special episode of what to do in skimming, what to do in scanning, how to do guessing work. Yeah. Instead of doing 10 tests, so do only one test properly, you'll get 12 out of 12. That's it. So number 9. Who is number 9 after Bipana Shah? Bipana Shah. After Bipana Shah is Sujata Perimbadas. Yeah. Sujata Perimbadas. Sujata Perimbadas 925. 925. These classes are very systematic. Remember that. You can notice that. After Sujita Perimbadas, Nasira Batul, your attendance will be taken like this. So if you are interested to attend the regular sessions, you register by enrolling, by paying the fees and other things. If you want to attend the free sessions, you can attend the free sessions whenever they are given. Nasira Batul. Yeah, B should be capital letter. Nasira Batul is 927. 927. How regular you will be, you are there, you will be selected. Okay, next one, Sujata Perimbadas. Then Chandan Mandal. Chandan Mandal. Okay. Chandan Mandal. Whenever you are coming, you have to come. Okay, Chandan Mandal is already taken here. Yes. Next one is anybody else? Names. Okay, those who have not given your names can register your attendance, please. Attendance. Those who have not written your names here, attendance, please. Yeah. So only 10 names are here. What about the others? So you can type your names and you can be registered here. Yeah. So next, so coming to the point, what is skimming, what is scanning, and what is solving? And next, the third one is solving. how to solve these answers. How to solve these answers, sorry. This is in green color. This is in green color. Let me take green color. Solving is these answers. Solving these answers using the words before and the words after. Words before and the words after. Words before and the words after. Or the same bullet. We can go to the same this bullet point. So these are the 4 points. The word which comes in the blank, the word before, the word after, and the words in the bullet point, parallel bullet point. Remember that. Yeah, majority of you have given. So we are moving forward. Yes. So first we'll see what is skimming. Skimming. So skimming. Skimming is red color. Skimming is red color. Now, what is this skimming? What is this skimming? Skimming. Now, skimming is a special stage. Skimming is a special stage. Now, in this skimming, you have to do 2 different things. Okay, you have to do 2 different things. Number one, headings. Number 2, subheadings. These are the 2 things you have to do in skimming. Headings and subheadings. Yes. Skimming goes into 2 areas, headings and subheadings. Now, what are headings? This is the heading. So heading is here. Subheadings are here. Patient, history, like that. These are subheadings. So you should read those things which are very, very important. These things are very, very important in this 2.5 seconds. Okay. 30 seconds. You have to complete all these things very fast. Then next we go to scanning. Scanning. Second one is scanning. Now, what is this? Scanning. Scanning. Yeah. Second point is scanning. 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 Okay. So scanning. Scanning what? Scanning what? Scanning. Next stage is scanning. So from here, we are going to scanning. Scanning what? Scanning number 1, names. Number 2, numbers. Number 3, new vocabulary. Number 4, difficult vocabulary. Number 5, special words and phrases. So these are the things. Yeah, these are the things. These are the things which you have to learn. Names, numbers, new vocabulary, difficult vocabulary, special words and phrases. Names, numbers, new vocabulary, difficult vocabulary, special words and phrases. So these are the 5 different things you have to know. Names, numbers, scan. Okay, now let us see how you are going to find these things. How you are going to identify these things. Names. Ophthalmologist is a name. Dominic D'Souza is a name. Numbers. 30 seconds. Okay. And numbers. You see, wherever number is there, that is very, very important. So number one, question number one, wherever number is there you have to be very careful, extra careful. Vocabulary, see, vocabulary like myopia, new vocabulary, if it is older, difficult vocabulary or new vocabulary, or special words. It may be three types, new vocabulary, difficult vocabulary, special words and phrases. Then symptoms, vocabulary. So apparent, maybe difficult vocabulary. Apparent means very clear, distinct. Okay, apparent, very clearly seen, easily noticeable. So like that, synonyms you have to know. So these are the things which you have to focus very much. Okay, now let me save this picture and keep it for you for future reference. Hide floating meeting controls. Yeah. So this is how you have to analyze. You have to analyze these things. Very, very important things. Print a screen. Okay, sorry. Yes. Print screen. So all these things will be saved in the Telegram channel, the main Telegram channel. That is classical corrections. Yes, here you will get. So that will be there. Okay. So it will be here. Everything will be here. So you can see, you can go through it and you can study. And this lecture is in the YouTube. Okay, this lecture is in the YouTube. You can go through that and you can revisit and you can listen again to understand the basics. That is very, very important. Okay, fine. So this is the point. This is what I have shown you. This is what I have shown you. Right. That's it. Next. Now let us go to the 12 questions. Here are the 12 questions. Yeah. Rabia, write your second name, please. Rabia, write your second name. Yeah. So type your name, first name and second name in the chat box. Next one, coming to the point here, history of the condition. Now we are studying. Now first skimming. Now first we are going to skimming. Now let us see what is skimming. Skimming should be, yeah. Now 3 stages we are going to do. 3 stages we are going to do these 3 stages. What are those 3 stages? Okay. Listening happens in 3 stages. Listening skill happens in 3 stages. Number one is skimming. Number 2 is scanning. Number 3 is solving by guessing. SOLVING, solving by guessing. Okay, this solving by guessing. By guessing is in brackets. Okay, solving by guessing. So this is how you are supposed to do. Let us take 36. What is end? Okay. No. Redo. Yeah. Yeah, this is it. I'm not an expert here, so just bear with me. So listening skill has 3 stages. Listening skill has 3 stages. Okay. Now in these 3 stages, right. So we are going to the first one now. First one, skimming. What should you do skimming? Skimming means what you are going to do. Okay. So skimming means this one. History of the condition. Then next, optician consultation. Then next one is presenting symptoms. These you have to skim. History, consultation, symptoms. History means back. Consultation, okay, optician consultation, okay, is with a specialist. Symptoms, body. History of the condition, optician consultation with a specialist, and presenting symptoms means signs and symptoms. So these three things you have to skim. This is the first stage. Okay, with all the 12 questions, you should do skimming first. I'm taking first 5 questions here. Okay, I'm going to ask you one more thing. It will take a little time. It will take a little time. Rabia Rizwan, very good. Thank you very much. Yeah. So now what I'm telling you is, yeah, what I'm telling you here is my question to you. Yeah, my question to you is, are you ready to learn the strategies? Okay, that means strategies means tips and sorry, these are techniques. So there are 4 T's. These are called as 4 T's. 4 T's. First one is, number 1 is technology. Technology. Number 2 is techniques. Number 3 is tips. And number 4 is tips. So these are the 4 T's which I am telling you. Are you ready to learn this? If you are ready, say yes. If you are not ready, say no. Because if you all say yes, then I will give all the tips, tricks, techniques, and technology. If you say 50% say yes and 50% no, I'll give only 50%. If all the people say no, I'll not give any tips and tricks. It depends on your mood. Come on fast, yes or no. I'm ready. I'm ready to give everything, whatever I have, I'll give you. But I'll see how many of you are interested. Okay. If 50% say yes and 50% say no, then that means 50-50 I'll give. Okay, only 50% of the tricks. Yes. Yeah. Okay. So we are moving forward with the public opinion, majority poll. Right. Now let us see here. So this is called skimming. We are going with skimming. We are heading forward with the skimming. So there are 3 points here: history of the condition, optician consultation, and presenting symptoms. So these are very important. So these are the paragraphs like, so history of the condition means past story. History means past story. History means past story. Optician consultation means a particular meeting, a review or appointment with a consultant, consultant or an optician. And presenting symptoms, how do you know what type of symptoms, signs and symptoms suggest some disease? So what are the signs and symptoms? That in the next part we'll see. Okay, this slide we are going to we are bothered only about these particular things. Yeah, this is taken from the official website. This is taken from the official material, but this is for the public service. This is free. This is free. So I acknowledge this to the official OET. Right now, let us see here. They have given us these materials for the benefit of the students. So we are making the best out of it. Okay, we are making the best out of it. So here, skimming is the first step. History of the condition, optician consultation, and presenting symptoms. So history means all the background details will be there from the beginning till now. Optician consultation will be there only with an expert. What happened with an expert? Then presenting symptoms means what are the symptoms that are visible, understood, perceived. Okay, perceived. Right. Now that is skimming. Headings and subheadings. Headings and subheadings. Remember that. Next one is a scanning. Scanning. Now when you say scanning, I'm changing the color to red now. Scanning. Second one is scanning. Second one is scanning. Now scanning, what you are going to scan? Scanning 5 different things: names, numbers, new vocabulary, difficult vocabulary, special words and phrases. Now you see, very easily you have to identify these things. Now let us see scanning. Yeah. Now from here, you see first point, glasses. Glasses. Glasses is a name. Then next one, myopia. Symptoms. Okay, like this one. You have to go like this. Now let us see. I'm not showing some arrows. Okay. Now next one is another word. Deterioration. Okay. Next, left eye. Possible. Possible means signs and symptoms. Then lutein. Okay. Prescribed. Okay. Then recommended. Suspected. So these are some words. Now you have to identify these special words. You have to identify these special words. Now what are these special words? Glasses. Age-related myopia. Okay, symptoms. So all these are not important. All these are not important. Only those, wherever the answer is there, that is important. You have to understand this one. This is important. This is important. This is important. This is important. And this is important. Out of how many bullets you see here? 1, 2, 3, 4, 5, 6, 7, 8, 9. Out of 9 bullets, only 5 bullets have the answer questions. So remaining 4 bullets you can ignore. You can just rule them out. You can just rule them out. So this is ruled out. This is not necessary. This is not necessary. This is not necessary. Okay. This is not necessary. This is not necessary. This is not necessary. This is not. 4 sentences are not. So 50%, almost 50%. 50% is unnecessary. 50% is unnecessary. When you are doing scanning stage, you have to mind these things. You have to mind these things. You have to ignore these things. You have to ignore these areas. In the scanning stage, ignore these areas. Finished. Ignore these areas. So that's it. 50% time is saved. 50% time is saved. So next one. Wherever the blank is there, how to go? How to go? Wherever the blank is there, go there. So you need not read all these things. You have to think, focus on these areas. Circles. Now I'm going to circle. So symptoms. Let me take blue. So symptoms. Okay. Symptoms. Right. Symptoms. Next one is, has recently stopped working. This is working. Means it's a profession. Working means it's a profession. So you'll get one word from each one. Okay. So this is related to a symptom. Symptoms first apparent in poor dash symptom. Second one is working, work, his work, his work. So it is related to work. So try to understand what I'm showing you there. Possible dash observed. These are observations. Observations means symptom only. Observations in the left eye. Observed in the left eye, the word before and the word after. So possible means signs and suspects, signs and symptoms. Observed means observe the symptoms. So one word before and one word after. Poor, poor what? Okay, poor what? Okay, poor what? And here A, the word before. A, the word before is very important. The word before is very important. Then next one, increased intake, consumption, increased intake, consumption, maybe food, maybe drinks, maybe air. Okay. So whatever, which goes inside. So intake, okay, ingestion, nasal ingestion, oral ingestion, intake, okay, intake. Then there are other types of intake also. So through intravenous, through veins. Remember that, through the veins. Remember that one. Intake may be anything, okay? Intake may be anything related to how. So the next one is consumption. So consumption, consumed oxygen, okay, inhaled oxygen, ingestion of oxygen, intake of oxygen, any synonymous words. Recommended by whom? Recommended by the doctor, recommended, prescribed, suggested. Okay, recommended. Passive voice. Very important. These sentences you can use in your writing. Increased intake of fluids are recommended. Passive voice. The same sentences, whatever you listen, whatever you write, you can use it in your writing. Remember, I'm not teaching you just listening. I'm using. They are speaking. This is a web. Okay, this is a web. What you can say, it is an interwoven web of skills. Don't think this is speaking. Don't think this is reading. Don't think this is writing. Don't think this is listening. What is listening is actually spoken. The person is doing some speaking, and that same sentences are coming into listening. These same sentences you can transcribe into writing. Remember, I'm telling you once again, you have a lot of chance to learn how to do writing through listening, because this listening is actually speaking between a medical professional and a patient. It's a speaking, you know that one. It's a dialogue between a medical professional. It's actually a speaking. That speaking is coming to you as a listening, and this listening you have to transcribe into writing. Remember, I'm not joking. If you don't understand the importance of what I'm telling you, you're losing many things. Next one, suspected, doubted, okay, because of signs and symptoms. So causes, concern, worry. Okay, dash suspected. So you should understand like this. You should understand like this. This is the way how you have to think. Now let us see. Poor. Poor is an adjective. Poor is an adjective here. Poor is an adjective. This is an adjective. Okay. So after an adjective, a noun will come. Adjective and a noun. Adjective. Plus noun. So poor eyesight, poor observation, poor understanding, poor. So you will get these things. Now try to understand what I'm showing you here. So now let us word by word. Poor adjective. So this will be a noun. Poor is an adjective. So this will be a noun. So you can understand the relationship between these two things. Okay. The relationship between these two things. Is the same relation between these two things. Poor dash. So has worn glasses for 5 years, age-related myopia. Okay, symptoms first appeared in poor. Brain starting session starts. Brainstorming. Brainstorming session commences. Yes, question 1. Yeah, come on, write down what you are expecting here. What you are expecting here. Write down in the first answer. Come on, fast. Any word which you think you can write there. Come on, write down whatever word you think. Write down, please. Yeah. Nasra Muhammad, eyesight is one word. You cannot write 2 words. Okay. Yeah. Yes. What about the others? Write some more answers. Write some more answers. Eye vision, 2 words. Eye vision, not 1 word. Eyesight is 1 word, but eye vision is not 1 word. It's 2 words. Yes. Welcome, Suja. Type your name, Suja Chellam, in the chat box. That is your attendance. Yes. Noreen, Kelvin. Kelvin's K should be capital letter. Yeah. Eyesight, Kurram. Eyesight is 1 word and E small letter. In the middle of the sentence, nowhere capital letter. So write it again, like how Nasra has written. Please, Kurram. 2 mistakes are there in your presentation. Yeah. Yes, come on. Now question number 2. Now let us move on to question number 2. Don't write anything now. Okay. Now let's listen what I'm showing you. Second number. Point number 2. Point number 2 is here. Point number 2. Stopped working as A. A dash. A is an article. A is an article. A is an article. Remember that. A is an article. So this is number 2. A is an article. A is an article plus noun. So when only 2 places are there, A is an article plus noun. So you have to remember that. A is an article and a noun. So you can understand very clearly now that A is an article and this blank is a noun. A is an article and this blank is a noun. A dash. So A officer is wrong. A engineer is wrong. A university lecturer is wrong. A lecturer is right. A teacher is right. A podiatrician is right. A ophthalmologist is wrong. A optician is wrong. A officer is wrong. A clerk is right. A counselor is right. A salesman is right. So now we are moving to question number 2. Yes. Question number 2. Yes. You can now give the answers. Question number 2. Yeah. Give the answers for question number 2. What do you expect? A dash has recently stopped working as a dash. Any name you give, any name of any profession. A carpenter, a plumber, a doctor, a teacher, a lecturer, any name. Give as many names as possible. Car driver, very good. Come on, come on, come on. Give as many names. Brainstorming is more important. Brain is the problem. Brain is the problem, not your knowledge. Brain is the problem, and action of the brain is more important. That is what brainstorming. If you stay silent, that means you are a lazy fellow. If you are actively participating, you are very active. Carpenter, sing, no capital letter, Kuramzia. Rewrite it with small letter. So teacher, the more you give names, the more your brain is activated. I'm trying to activate your brain. Yeah, it should be like a snake slithering into a hole. Very fast, very fast. Okay, otherwise, yeah, it will give as many names as possible. Why do you want to Suja Chellam, C small letter, carpenter, rewrite with C small letter, please. Plumber, lecturer, give as many names as possible, fast. This is how you have to think in the exam. If you don't, see, if you don't actively participate here, how can your mind be fully charged in the exam? Charge your mind now here. When your car goes onto the road, yours is an electric car. Electric car. So charge it fully now, so that when you run on the road, you can run very fast. That's more important for me. I'm trying to charge you. Yeah, nurse, carpenter, driver. Come on, give more examples. You don't know more examples? Otherwise, at least listen to me and write all the words. Na? A electrician, wrong. An electrician. A electrician is wrong. An electrician. So electrician will not come. Then engineer will not come. Plumber will come. Carpenter will come. Mason will come. Driver will come. Then salesman. Accountant will not come. A accountant, no. A accountant will not come. So when I'm saying an accountant is okay. But a accountant, okay, will not come. An accountant. Okay, you can write down. Anybody of you who is very active, Maimuna, you can write this one. Whatever I'm saying will not come. An accountant into. Okay, an accountant into. Put across X, big X, capital X, right? An accountant and put capital X. An engineer, X. Okay, right. So teacher, yeah, an accountant and put into mark immediately next to that one. So an accountant will not come here. That is the meaning. So then salesman will come. Then cashier, a cashier. Write down the word cashier. Then supervisor, manager, director. An officer will not come into. An officer into. So supervisor. Then come on, security guard. Yeah, very good. Security guard. Watchman. Headmaster. Then what? Computer operator. You can take that one. Then you can take conductor, sweeper. Come on. Now people are writing. Yes, very good. This is what I want. Come on. Write down as many names. Musician, very good. Singer, dancer, waiter. So come on. Come on, think, generate as many words as possible, because these will come in the exam. If you don't energize your brain, power, sense with all the trainer, yes, trainer, fitness trainer, okay, podiatrician, any name, whichever you get, you can give, because all these names you will be using in their exam. You should be ready with all these names. That's what it. Journalist, very good, Anushka. Journalist, right? Typist, 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 photographer, librarian, wonderful, wonderful. People are activating their brain. Very good, very good. Librarian, very good, very good. So those students who are doing like this, they can get 12 out of 12. Definitely they can get 12 out of this. Then librarian. Yeah. CG Jason, welcome. Type your name in the chat box. Suja Chellam, type your name in the chat box. So whenever you people come, you have to write your names in the chat box. That is your attendance. Yeah, photographer. Then, yeah, reporter, newspaper, reporter. Okay, videographer. So like that. Yes. CG first name capital, yes capital and J capital, remaining small. First, it's always like that. S capital and other small letters. G and J capital and other small. That's how it is. Yeah. Journalist. Then, right. These are enough. Now next, we are moving to the next one. Question number 3. Possible dash. Possible, more possible, most possible. So this is an adjective. Possible is an adjective. Now let us see this one. Possible is an adjective. Number 3. Adjective. When adjective comes, after the adjective will be a noun. After an adjective will be a noun. So this is a noun. Adjective plus noun. That is what is there in the first place. Here also you can see the same pattern is repeated. Adjective plus noun and adjective plus noun. You can understand the pattern. Now you will learn how the patterns are. Adjective plus noun. So possible dash. Possible dash. Possible what? Possible dash observed in the left eye. Possible maybe what is that? Cataract. Possible cataract maybe, or possible something maybe, whatever it is. So question. So now here you can notice possible. Possible is adjective and this dash is noun. So you will get a noun here. Now question number 3. Q3. Yeah, question number 3. Give the words which are related to this one. Possible dash observed in the left eye. What observed in the left eye? Come on. Somebody, Anushka wrote cloudiness. Very good. Conjunctivitis. Spelling. Somebody's helper. Sujachellam. She's a very good student. But spelling she doesn't know maybe. Or I don't know maybe. So help me or help her. I think that the spelling is something different. If anybody knows, okay, help us. Yeah, conjunctivitis. This is the spelling. Conjunctivitis. Sujachellam. Write again the spelling. Conjunctivitis. Write the spelling which is written by Sangeeta in your notebook, and you can learn it by writing 5 to 10 times and learn the spelling because it will come in the exam. Yeah, Nasra. Very good. Conjunctivitis. This again. Conjunctivitis. Spelling. Is it conjunctivitis or conjunctivitis? Be careful. Nasra. I don't know whether your spelling is correct or Sangeeta's spelling is correct or Sujachellam's spelling is correct. See how many different spellings are there. Conjunctivitis spelling you have to know. It has only one spelling. You cannot have 2, 3 spellings. Okay. So this is Cambridge Dictionary. And here it is CONJU. Conjunctivitis. Conjunctivital. Okay. Conjunctivitis. Yeah, this is conjunctivitis spelling. Okay. Come on, check your spelling here. So that is the spelling. This is the spelling. Okay. Conjunctivitis. This is the correct spelling. This is the correct spelling, says Cambridge Dictionary. Okay. Cambridge Dictionary gives you the correct spelling. Here it is, the last word, last letter. Okay. Yes. Learn the spelling. Those who don't know, write it 10 times and send it to me. It's not a joke. How can you do mistakes in the exam? Okay. Not only your name, don't think it is you are paying the fees and going to write the exam. I'm spending my time equally. So both of us are writing the exam. It's not only your exam, it's my exam also. We are together in the battlefield. I am the commander and you are the soldier. If you are failing and if you are losing the battle, that means I'm also losing. Okay, be careful. I will not drop you, let you drop you dead there in the battle. We have to be victorious against the OET. That's it. So, what are the words you have given? Yes. So conjunctivitis, yeah. What are the other words? Possible dash observed, cataract, conjunctivitis, any other astigmatism, squinting, myopia, yeah, redness, okay, whatever it is. So, right, this is one. Next one, we are going to question number 4. Discharge, okay. Discharge 4. Yeah. Question number 4. Now, question number 4 is increased intake of dash recommended. Increased intake of. Of is a preposition. Of is a preposition. Intake of something. Intake of something. Intake, ingestion of something. So, of is a preposition of something. Okay, of something. So here, you know, this pattern is something like, yeah. Preposition plus noun. After preposition, there will be a noun. Remember that. After preposition, there will be a noun. This is the format. This is a new style now. Okay. This is a new style of preposition, and this will be a noun. So remember that. Preposition plus noun. Preposition plus noun. Intake of something. Intake of something. Maybe diet. Increased intake of whatever it comes. You write. Otherwise, whatever you hear from me, that you write. You do whatever you want. But I want. Yeah. So diet high in fiber. Fiber rich diet. Fiber rich diet. Yeah, green leafy monarch, G small letter, green leafy vegetables, leafy, L-A-L-E-A-F-I, leafy. Spelling mistake, 2 mistakes are there. 2 mistakes are there. Yeah, green, G small letter. Then next one. Come on, write down your words, whatever you want to write. Intake of fluids, okay. Increased intake of fluids, increased intake of liquids, increased intake of proteins, increased intake of carbohydrates, increased intake of fiber, increased intake of fatty acids, increased intake of fruits, increased intake of nuts, increased intake of notorious diet. What do you mean by notorious, Anushka? Is it typing mistake? Huh? Or is it a computer mistake? I don't know. Okay, notorious diet. Oh my God. Wonderful, but be careful regarding this word. Okay, notorious. I know it is typing mistake. Your computer automatically typed that word because you spelled wrongly. Maybe it has directed. Okay, nutritious, because maybe you don't know the spelling of nutritious. Learn. Somebody help her. Nutritious. Somebody help her. Why all of you are sitting silently? Why don't you help her? What are you doing? United we stand, divided we fall. Somebody writes spelling mistake, you have to correct and help her. Okay. What are you doing? All these people in the platform. Huh? For everyone you need Simon sir, no need. There are many people who knows the spelling. Yeah, that's a nutritious diet. Very good. Now people will be active. One of your brother or one of your sister falls down. Okay. You have to support and help. You don't need my command for that one. Somebody is falling in the battlefield, you have to go there, pick them up, not just fighting your battle. You should save your friend also, because if you save your friend, then tomorrow you will fall down, he will save you. That's it. Nutritious diet, low salt diet, then low fat diet, high vitamin rich diet. Think about all the possibilities. Low salt intake is already there. Anushka, intake is already there. Low salt diet. Okay, right. Next one. Fine. Fourth one is done. Now we are moving to question number 5. We are moving to question number 5. Dash suspected, something suspected. Dash suspected, something suspected. So dash suspected. So here it is question number 5. Yeah. Question number 5. Question number 5 is noun plus verb. Noun plus verb. Something suspected. Something is suspected actually. Passive. Passive verb. This is passive verb. Passive, sorry. Passive verb. That is, something is suspected. Something suspected. Passive verb. Okay. Suspect. ED means V2. So, noun and suspected. Okay. That's it. So this is question number 5. Something suspected, cause for concern, something suspected. What is suspected? Cause for concern. Okay, increased in, so this may be increased intake of dash. Dash is suspected, some problem suspected. So fifth one, question number 5. So what do you think the answer is here? Yes, retinopathy, astigmatism, infection, cataract. So this is detachment. Detachment. Yeah, come on. Retinopathy. Yes. Come on, any other words? What is suspected? Hypermetropia, myopia. Very good, very good. Excellent. One second. Yeah. So, okay. Right. So 5 points are over. Cataract, glaucoma, cataracts, Nurin Kelvin. Cataract spelling is mistake. Cataract spelling, C-A-T-A, rewrite. Yeah, rewrite the spelling. You have to learn and write 5 times in your notebook. Yes. So this is the second point. Okay, print a screen. This will be posted in the Telegram channel. Yeah. Yes. Right. Now, next question. My next question is, shall we move on to the next slide? Say yes or no. So we'll finish all the 12 questions. We'll be equipped with all the points. Then we can go to the next. Why is my video not showing? Yeah. So we are moving to the next slide now. Yes. Okay. Now, this is the presenting symptoms. Fifth one is over. From presenting symptoms 6 to 12. From 6 to 12. Okay. Now from 6 to 12. Fifth is already done. 6 to 12. Get ready. Yes. Now, okay. Yeah, go through these 7 questions. I'll prepare some tea for me. Go through these 7 questions, please. Yes. Think about all the answers and make a possible notes. Yeah. No, don't write anything now, Suja. Just make a notes in your notebook. Yes. So, no problem, Suja. Yeah. Now let us see. Think about this again. Question number 6. Don't write anything now. We are going to discuss now. Question number 6. We are discussing question number 6. Now let us take question number 6 here. Question number 6. We take here question number 6. Dash judging dash of objects. Judging dash of problems judging dash. Subject, this is noun, this is verb, judging, and this is problems are judging. Okay, dash of objects, judging dash of objects. So this is judging drinking water, like that. Drinking water, drinking is a gerund. Okay, verb in verbal noun. So now you can see here of object, something of, something of. So this is dash of preposition. So noun plus preposition, before preposition plus noun, and noun plus preposition. Of is a preposition, you should remember that. So this is how. So preposition, noun plus preposition, noun plus preposition. Preposition is of. You should know that preposition is of. Something of objects, something of object. Problems judging something of objects. Color of objects, maybe distance of objects, maybe okay, clarity of objects, maybe size of objects, maybe height of objects, maybe width of objects, maybe length of objects, maybe breadth of objects, whatever it is. So now guess your answer. Come on, brainstorming commences for the second slide. Problems judging maybe brightness of objects. Okay, far of objects. No, far is an adjective. Noun will come. Noun. Distance of objects. Yeah. Dark. No, dark is an adjective. Darkness. Yeah. Shape of object. Exact shape of objects. Very good. Clarity, length, distance, brightness. Maimuna. Very good. Clarity. Come on. Brainstorm. You should know that in the military, the commander will be always shouting. It's called chivalry. It's not anger, it is called chivalry. Performance is more important. Somebody is shouting or somebody is crying is not important. Whether we are winning a war, winning the battle, or losing the battle is more important than losing a life. Battle is very important. Yeah. Distance, color, shapes, no. Judging shapes. Yeah. Plural also correct. Shapes of the object. Yes. Very good. Excellent. Now we'll go to question number 7. Question number 7. Central vision is dash. So is something. Central vision is name of the quality, is adjective, quality. Central vision is maybe vision is clear. Adjective will come. Is plus adjective. Verb plus, so noun plus verb plus adjective. So this is called noun plus verb plus adjective. Noun plus verb plus adjective. He is clever, like that. He is very clever, like that one. You should remember that. So noun plus verb plus adjective. Come on, shoot out your words. He is clever. Vision is impaired. Vision is blurred. So whatever it is, now you understand what I am talking. It should make sense. Central vision is noun. Vision is noun. Is verb. And impaired or blurred or confused or reduced, okay, enhanced, okay, clear, vision is clear, maximized, okay, affected, very good, very good. Come on, guess the words. Diminished, okay, deteriorated, normal, very good. Rabia, very good, normal. So for those students who attend the classes regularly, yeah. Yes, affected, abnormal, blind, very good, very good. Central vision is blind. Vision is blind, it doesn't suit. Vision cannot be blind. Yeah. Next one is question number 8. So you can ignore this part. You need not worry about this. You need not worry about this. Okay. So general vision, dash vision unaffected, dash vision unaffected. So dash vision unaffected. Near vision, far vision, central vision, or whatever. So question number 1 minute. Peripheral vision, yeah. Question number 8. Question number 8. Question number 8, yeah. Dash vision, adjective and noun. So next one is adjective and noun. Adjective and noun. Okay. Adjective plus noun. So dash vision. So this is an adjective and this is noun. Near vision, far vision, distant vision. Distance is noun, sorry. Distant, Sujachalam, correct it. Distant, T-A-N-T. Rewrite it. Very good. You gave a correct answer, but wrong form. Wrong form. You can correct it. Temporary vision. Okay. Fine. Permanent vision. Distended. No. Distant. T-A-N-T. Distended is verb, but the word is also not there. Okay. Distant. Okay. Yeah, this is right. Very good. You learned a new word. Yeah. So distant vision. Next, has stopped dash. Has stopped dash. Gerund. Has stopped crying. Has stopped working. Has stopped operating. Has stopped smoking. This is regarding general vision. Smoking, seeing, eyeing will not come. What you are seeing there in the paragraph, see, has stopped. Distant. General vision has stopped smoking. What do you mean by has stopped smoking? It will not come. Okay, Sangeeta Patel, I don't know what you are writing there. Okay. So question number 9. Question number 9. Question number 9. Reason properly. So stopped. Verb plus gerund. Gerund is equal to verb plus noun. Verbal noun or verb plus noun. So that verb plus ing, sorry. Verb plus ing. Or you can say V4. V4. V4, yeah. Central vision has stopped acting, has stopped working, operating, like that one. Whatever comes, you can think about that one. Be careful. So stopped verb gerund. Stopped, yeah. Functioning. Stopped working, stopped operating, stopped functioning. Not function, functioning. Nasira Batul, functioning. Yeah. You can not say function, has stopped function. No, has stopped functioning. It's not cooking. It's not, it doesn't suit. Vision does not. Vision is here, noun. This you should not miss. It's talking about vision. Vision stopped functioning. Yeah, vision stopped exercising. Sangeeta, spelling mistake. Correct. Yeah, not correct. Not spelling mistake. Correct. Stopped functioning, stopped exercising, stopped working, stopped operating. Very good. Thank you. Yes. Vision started looking. No. Stared. No. So you have to be little careful. Yeah. Next one. We'll go to question number 10. Question number 10. Ask for clarification regarding, concerning, related to. Clarification regarding something. Regarding something. Regarding medication. Yeah. Regarding plus noun. Regarding. Concerning, related to, about. This is regarding is what actually here? Is it a preposition? Check. Yeah. What is this word regarding? Regarding is preposition. Regarding is preposition, means about. Regarding is a preposition, formal, very formal. Use this word in your OET, writing and in your speaking. Very formal word. Though it is B1, it's very formal word. Regarding is preposition. Okay, regarding is a preposition. Regarding is a preposition. Remember that. Regarding is a formal preposition. Use it. Regarding is formal preposition. Because it is, you can see it. What is the level? B1. B1 vocabulary. B1 vocabulary. B1 vocabulary. What do you mean by B1? If about, if you take the word about is also a preposition, but it is A1. A1. About is A1. About is a preposition. Preposition, but it's a A1 level, A1 vocabulary. So why do you want to use about? You can use regarding. That means 200 marks increasing. A1 is 100 marks. A1 is 100 marks. A1 100 marks. If you do A1, you will get 0 to 99 marks. If you use A2, you will get 100 to 199 marks. Okay. If you get B1, if you will use B1 words, you will get 200 to 299 marks. Yeah. If you use B2, you will get 300 to 349 marks. Yeah. B2 300 to 349 marks. You can also say B2, you will get 300 to 399 marks. No. A2, A1. If you use A1, sorry, C1, your marks may be from 350 to 425 marks. If you use C2, your marks will be from 425 to 500. So this is how it is. Right. So remember this marks scale. Why I'm telling you these marks? Very important. Okay. So next one then, regarding something. Preposition plus noun. You remember already preposition. Noun plus preposition or preposition plus noun. This will be preposition plus noun. So preposition plus noun. This is the format here. Preposition plus noun. So regarding is a preposition, remember. Regarding is a preposition. So preposition. So here this is a noun. So noun will come. Regarding something. Regarding something. So question number 10. Question number 10. So you already wrote some words. Okay, regarding medicine. Consent, spelling. What is this consent? Consent. Consent. Spelling mistake. Somebody help Noreen Kelvin. Consent. Spelling of consent. Ask for clarification regarding consent. Yeah. Yes, come on. Any more? Treatment. Yeah, come on. Consent. Yes, Nasira Batul. Correct. Thank you. Thank you for helping Noreen. Yes. So very good. Only the serious people will be there, others will be going. Yeah. So consent, that is number 10. Number 11. So we are going to point number 11 now. Question number 11. Question number 11. 11 is leaking. 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 Suspected. Leaking. Verbal noun. That is gerund plus noun. So this is gerund. Gerund plus noun. Gerund plus noun. So gerund plus noun. Falling, drowning people. Okay. Running individuals. Suffering patients, like that. Gerund plus noun. Gerund means V4 or verb plus noun. I already told you. Gerund is V4. Drink, drank, drunk, drinking. Drinking is V4. Verb plus ing. So you should understand that one. You should understand that gerund is verb plus ing, which is called a V4. V4. Yeah, that's it. V4. Gerund is V4. It is also a noun actually. Verbal noun, we call them. So here it's an adjective. It's doing the role of an adjective. If it is doing the role of a noun, it is a gerund. It's a compound noun. It's doing the role of, yes, leaking. It's doing the role of an adjective here. Compound noun, it may leaking, suffering patients, compound noun. So leaking is a gerund, and this is a noun. To test for suspected leaking dash, leaking vessels, maybe leaking something. So treatment options explained. What is that something? Question number 11. So question number 11. Yeah, give the answer for question number 11. What do you think here? What are you expecting him to hear? Leaking blood vessels. Yes, leaking pus. Okay, good. Leaking something else other than pus. Medical doctors. Lacrimation, Sujachalam. Leaking, lacrimation. Leakage is called lacrimation. Lacrimation is a noun. Very good. Leaking, lacrimation. Okay. Let us see what it is. I don't know what is lacrimation exactly. Leaking eyes. Okay. Leaking tears. Okay. Yes, please. So the last one now. Question number 12. Question number 12. Need for. For is a preposition. For is a preposition. Remember. For is a preposition. Make a list of all these things. Prepositions. So in, regarding, for, these are prepositions. So preposition will get a noun after that. Preposition will get a noun after that. Preposition plus noun. For dash, for something. Possible need for operation, maybe. Express concern about possible need for injections, maybe. Anything may be there. So question number 12. Question 1, 2. Question number 12. Need for. Expressed a concern about possible need for injections, medication, need for operation, need for surgery, need for transfer, treatment, need for intravenous injections, need for air referral, Sujachalam, air referral. Singular noun is air referral. Okay. Very good. Thank you. Thank you for your obedience. What about others? Come on. An operation. An operation. Nooreen Kelvin. An operation. An operation. Okay. Yes. Good. Then next one. Eight. Treatment enough. Need for treatment. No need. A. Surgery. No need. A. Very good. Very good. Yes. Yeah. Very good. All right. So are you ready for the attack? I already fueled you now. Are you ready for the attack? Yes. Not many people will be there. Only last till the last battle. Some people will die in between. That is not our problem. We'll only till the last stage. Are you ready for the attack? Say yes or no. Yeah.